Welcome to another episode of Turnpaugh Talks. We're here with Dr. Regina Smith, who has really been our core internal medicine doctor from day one, and wanted to bring you on the show. Thanks for coming in.
Thanks for inviting me.
And so we're just starting off by reintroducing everybody in the practice to the community at large. And so I'd like you to tell us a little bit about your background, how you went to med school and or osteopathic school, and then how you got to where you are today.
Yeah. Well, starting out, I always loved animals, and I thought I wanted to be a veterinarian. So that was kind of my original thought, that I was going to go to vet school and take care of animals. But I kind of didn't want to have to put them to sleep, and I kind of didn't like that idea, and worked in a nursing home and was a medical assistant taking care of people on a personal level, and decided I like to go more with medical for treating people. And that kind of got me into more deciding if I wanted to go into medicine as a career or a PA or something of that sort. Okay. So I went to Wellesley College and did pre-med, and while I was there, I read a book by Bernie Siegel, Love, Medicine, and Miracles, which was psychoneuroimmunology.
Early psychoneuro, yeah.
Yeah.
The Bernie's work was kind of like think happy thoughts, right? Yeah.
Yeah. And it was,
more than that, but.
Yeah, it was basically like you can train your white blood cells to go around and fight off infections or cancer, and how much the brain had influence over the body for healing. And that kind of really turned me on to the holistic side of medicine.
Well, Bernie Siegel, he was not a physician though, was he? Or is he?
I believe he was an MD. I'm not
okay.
Sure.
All right, I didn't know that. Yeah.
I'm not sure his total background, but so anyway, after I wrote a paper on that in college, I was applying to where I wanted to go for medical school, and didn't know, still if I wanted to do naturopathy or MD or PA, and decided I like the DO philosophy because it's about helping the body heal itself.
Right. DO osteopathic, right? Doctor of osteopathy, right?
Yeah.
Which is different from an MD.
Yes.
Slightly in their philosophy.
Right. And a lot of it was more hands-on, touching the patient, making more of a connection, the musculoskeletal system and how it influences health. And so I got into that as a philosophy that I agreed with, and decided to apply to DO schools. Went to school in Ohio, did my residency in Warren, Ohio, and got recruited to Altoona, Pennsylvania, by a hospital practice. And I was an employee, did hospital rounds and office work. Really enjoyed that, and then got recruited to Carlisle. Actually, my husband got called by a headhunter for another opportunity, and he said, well, do you have anything in Carlisle? That's where I grew up. And so they basically found something with the Carlisle Hospital and created something for me. So I joined up with them and did just outpatient work. Was in there for a couple of years, and then I went to a lecture that Dr. Neely did on functional medicine at the hospital Grand Rounds, and it was a lunch talk. Mm-hmm. And while I was at the talk, Kathy Ferraro's husband was sitting behind me and communicating with his wife, who was at the functional medicine conference at the time, and she was basically saying how wonderful this is, and it's amazing. Oh my gosh, I can't believe how much this is going to be.
Was that Dr. Ferraro's first functional medicine lecture?
It might
one
have
of
been.
The first, okay.
And so I spoke with her afterwards, and she really encouraged me to do that, and started on the functional medicine track. And I had met you through my sister-in-law, Kara, mm-hmm. and had been getting a few patients already that were talking about leaky gut and chronic Lyme and things that I had never learned in my traditional medical field. And looking back at 10 years of regular hospital and office medicine in Altoona, I thought, oh, wow, there's all these patients that I've missed. Something else that could have been done to help them. So I figured it was my duty to really learn, what else I could do as a physician to help people. And so on that journey of functional medicine, became also Lyme, and joined ILADS and learned about chronic Lyme, and lots of other things branched out from there. Although sometimes it seems like you can't know everything, and it can
Although
be
I
very
do know
overwhelming.
you never ever stop learning and educating yourself.
Yeah.
So,
And so then I think at one point I got frustrated being at the hospital practice because I couldn't really do what I wanted to do. And I remember we kind of had this conversation, and you were like, if we build it, they will come.
and we built it, and they came.
Yes. So then coming here, having two of us here and other providers, it's been a great way of expanding my knowledge, and relationships with other providers has been great. And I think it's been a great experience in helping each other with trying to get each other better.
Sure.
And
Yeah.
helping all our patients.
So early on, I see a transition. You were going to deal with animals, but you didn't want to deal with the death part of the animal. But also early on in pre-med, you were exposed to Bernie's work and realized there's so much more than just, even at a very young age, there's so much more than just standard allopathic medicine, or what was accepted at the time. I don't want to pick on allopathic medicine, but what was accepted at the time. So Bernie Siegel's work is outside the box for sure, right? So your thoughts can influence your white blood cells. That sounds woo-woo, but now we know it to be true. So you kind of went in and went to osteopathic school with that open mind. And what I'm also hearing is just a tremendous compassion to really connect with the patient. I know that's an unbelievably strong suit that you have as a physician, is your patients absolutely love you. You take the time, you touch them through examination. You're not just reading off of a screen. You go the extra mile for every single patient that you see. And I know that even the fact you said you looked back and saw some of the patients where you might have missed something, and it wasn't, oh, I could probably learn something else. You felt it was your duty to continue to learn. It's the kind of dedication we see in this office every day out of you. I love the journey and how it's progressed, and constantly being open to learning new things. I know you're one of, if not the leader in the office, who's always bringing us new information on, hey, did you guys know about this? And did you read this latest research? How do you possibly stay current on all those things?
It's difficult. Not only do you have to keep up with your charts, but to keep abreast of what's going on. And going to conferences definitely helps. Keeping up with what's out there among my peers,
Right.
Other colleagues that are already studying all this and learning what they're doing. And with all of us going to different places, it's good because, you can go to that conference and I can go to that conference, and then we come back and, what did we learn, and collaborate, which makes it nice that we don't have to know everything that one of us might have.
Right, somebody knows it.
Somebody
I know
knows.
early on you studied pretty heavily with Lyme disease, and you actually spent a weekend with Dr. Horowitz, who's one of the leading experts. And how was that?
That was very nice to be with people that were in the same boat, that all had the same belief that these chronic Lyme patients needed help, and that there was stuff we can do to help them get better, and learning about what's worked for him and other practitioners that were there, learning about different therapies that can be helpful, and all the new things that have come out in the last couple of years, even just with dapsone and disulfiram and low-dose naltrexone. Lots of new things is exciting.
It's
peptides.
Really, it's an emerging field that you almost, if you don't dedicate some time and energy to it, you'll be left behind. But as you see, these patients are suffering and really have been told so many times by so many providers with so many letters behind their names, there's nothing really wrong with you. It can't be Lyme disease. And so if I were to come to you and say, I really feel terrible, I was tested for Lyme disease. My doctor told me it wasn't Lyme disease. I went to infectious disease. It wasn't Lyme disease. How might you approach that situation?
Well, definitely want to look at all the underlying factors influencing it, but you may do other testing that may expand on the testing that they've already had. They may not have had enough testing.
So there's
We're
more
looking
than
at
one type of
co-infections.
test for Lyme disease?
Yes.
Okay.
Yeah. And looking at all the other infections that go under that, other dietary influences, other stress influences, which may have affected their immune system, and they're not showing any antibodies to the bug. So there's a lot of underlying factors that need to be addressed, and sometimes you don't have the diagnosis except for clinically because the tests are not very accurate or sensitive.
So you could even have Lyme disease without a positive test.
Yes. And treating people have gotten better from their treatment for Lyme even without a positive test.
So
and sometimes after they're treated, that's when you see the tests turn positive.
That's fascinating to me. So somebody who doesn't have Lyme disease according to the testing, you still treat like they have Lyme disease, as if they had Lyme disease, and they get better.
Yep. And it's a clinical diagnosis, they say. Yeah.
So I guess if it wasn't a clinical diagnosis, a monkey can make it, right? So you could just plug in a blood test and tell them what's wrong with them. So there goes your tremendous clinical acumen. Like, well, it looks like a duck and quacks like a duck, but it doesn't come back on a blood test as a duck, but it still might be a duck.
Yeah.
And then I'm going to treat you like a duck, and lo and behold, it works.
Yeah.
Yeah.
And the tests are good for acute Lyme, but once they've had it for a while and it's not been treated, their immune system changes over time.
So it's an important message that you bring up to me that sometimes people have had these blood tests, but A, there's more than one type of test, and B, the blood test isn't where it ends.
Right. There's different strains of Borrelia that might not be detected on the standard Quest or LabCorp test, and sometimes you have to dig deeper to find other things that might be there.
And with your compassion and passion for patients, you're willing to sometimes go outside what the standard box says, not to try to be different, but to change a patient's life.
Right. Nobody else has gotten them better, and they're coming to me to help them. And if I don't go that extra step outside the box, they might never get well.
And this isn't theory. You're seeing patients get better.
Yep. Right. All the time. Yeah.
So that's impressive. Willing to take a patient with a chronic, my term, chronic I don't feel gooditis, and say, well, there's something wrong. And so many of these patients are told it's psychiatric. You're just depressed. You're just attention seeking. And we know that not to be true, right?
Right.
Although there may be a component of it. If I was sick for 10 years feeling terrible and everybody told me I was normal, I might be a little bummed out. So your traditional training includes board certified internal medicine. So you can be like a family doctor plus, right? Because you do all and so with that training, now you do functional medicine. They're not mutually exclusive, are they?
No.
So
you use both together to benefit the patient.
So we're not just talking about supplement pills and diet. We're talking about regular health care as well. Right. So
regular preventative things that you would do at a regular doctor's office. If their blood pressure is high and they need medicine to prevent a stroke, you use it. In the same time, you're trying to get their body back to health and get them off their medicine if possible, so they don't need it anymore.
So if I was a patient on a bunch of medicine, polypharmacy, and I come to you, you're probably not going to say, get off all that stuff right away.
No, that wouldn't be very good for the patient.
But you might work towards getting them to a point where they might not need that medication.
Right, with the right lifestyle treatment especially.
So talk a little bit about that. What kind of lifestyle treatments do you do? What does that mean?
Well, a lot of times there's food sensitivities or the wrong kind of diet, too much of the wrong nutrients and not enough of others, and too much sugar especially, and just getting them on a more plant-based diet is huge. People notice a difference. They feel better, more energy.
And that doesn't cost much money.
Right.
And just changing, it probably costs less money to eat vegetables as opposed to meat. I don't know.
Well, a lot of the cheap food is not good for you.
Right.
So there is a struggle there.
I guess there is some increased cost with higher quality food.
Right.
Probably negated by higher quality of life, though, right? So you get a higher quality of life.
Whatever you're putting in now is what you get in the end. So if you're not investing in yourself now, you're not going to have a good output in the end. When you're older, you're going to feel those consequences of your choices.
Right.
So a lot of times people just doing only the diet changes, they notice a big difference. Sometimes even people with Lyme disease notice the diet was the biggest thing that made them feel well.
Why do you think that might be?
Well, the immune system's in the gut, 70% of it. So if your gut isn't healthy from what you're putting in there, there's inflammation there, it's going to carry over to your immune system and your health, autoimmunity and infections take over, cancers, chronic disease.
Yeah, I know I've seen that as well, but you've seen people just change their diet who have been to many practitioners for, we'll just pick on chronic Lyme, but it could be any inflammatory condition.
Right, rheumatoid arthritis is a big one.
Yeah. So you see rheumatoid arthritis, they change their diet. They don't change any of their prescriptions or other applications, and the diet alone can make a big difference for them.
Right, especially gluten.
Okay.
And dairy and sugar.
Those are the big ones, right? Gluten, dairy, and sugar. Mm-hmm. And so, interesting, I had a conversation earlier. If you took gluten out of your diet completely, what are the risk factors for having no gluten in your system?
Lack of fiber would be a big one.
Okay. So can that be made up in any other way? So gluten is a fiber?
Right.
Okay.
Well, it's a protein, but a lot of times that's their biggest source of fiber.
Okay.
And you take away the gluten, and then they're not getting the fiber to support their microbiome in their gut, the good flora.
So is there a healthy way that may not involve, where else could I get some healthy sources of fiber from?
Well, you can get it from fruits and vegetables and other non-gluten grains and seeds and nuts and other plants.
So gluten in and of itself doesn't provide an essential nutrient?
No.
Oh, so, no. But sometimes it's packaged with fiber.
Right.
So the fiber's the benefit, but the gluten isn't the benefit.
No.
Right, it's just what comes with it.
And it's high protein, so you need another source of protein.
Okay.
But the other thing that comes with gluten in this country is Roundup. So,
so if I'm eating my gluten, I'm eating my Roundup. Mm-hmm. Usually, yeah. So.
Whereas in other countries, they don't have that.
This is why some patients can go to other countries and maybe eat their gluten and not have the reactions?
Right.
Okay. Yeah.
As you've mentioned with me several times with your colleagues that have been there and
they eat it.
They eat it.
They go there to eat it. So that's interesting. And so changing the diet can change the expression of many diseases. Mm-hmm. So that's a core principle for you, is just looking at that.
Right.
And food reactions and different things.
Right. So. Yeah, and then exercising, getting their insulin resistance improved by getting their muscles taking up the sugar. Helps their mental health, too. They've been sick a long time, and if they can exercise, they feel better.
So you had mentioned, too, like rheumatoid arthritis. If they change so if I come in and I'm eating a poor diet, which is attributing to my joints not feeling good, I'm probably not moving much.
Right.
So now I'm not using that insulin sugar thing in my muscle, right? So that sounds like a core foundation. If I eat differently, it might change how I feel, which then may change how I move. Mm-hmm. And as you kind of alluded to, which might change how I think, my mood. Mm-hmm. So have you seen mood changes from diet?
Absolutely.
Yeah.
Yeah.
Have you seen, even as much as like people on maybe mood medications, been able to get off their mood medications? Mm-hmm.
Sometimes, depending on the medication, they need to taper slowly to avoid withdrawal.
Right. This is not a substitute for medical advice. So, but under your excellent clinical care, you might be able to wean them off. Right.
Right. Or suggest other alternatives that might promote that pathway to keep their serotonin up, or whatever is that medication was doing to kind of ease them into that, and just slowly taper it. Or if they're seeing a psychologist or a psychiatrist who's prescribing it, have them tell their psychiatrist how good they're feeling, and do you think I can wean off my meds?
Right.
Because the more meds you have on board, the more your brain is sort of wired to that for life in a way. It's your receptors change in your brain, and it's basically become adapted to that.
So by taking the medication, it kind of changes the way your brain's wired.
Right.
I think I get an overwhelming sense that people on those medications almost don't want to be on those medications. They would love to find an alternative to get off those medications. However, it's pretty emotional when you felt bad. You take a medication, you don't feel as bad.
Right.
To jump off that cliff, which you're saying is not an easy jump, but there's strategies that you can employ to possibly give them the optimal outcome of getting off that medication.
Right. Taking medications is sometimes a stigma for them, too. If they're on an antidepressant, they don't like being on that kind of medicine. Whereas they might, although they feel good on it, they're afraid to come off of it a lot of times because they don't want to feel as poorly as they did.
Right.
So it can be definitely a struggle, but a lot of people do like to come off of them if they can. But most commonly it's because of side effects from the medicine.
Right.
They might feel apathetic or blah. No libido is a big one. Sexual performance is a big one.
So they want an antidepressant to not be depressed, but it's kind of depressing some of the side effects you get.
Yes. Yes.
Interesting. So again, going back, it's like a whole body approach. So why would I eat differently to help my brain? That's something you kind of own and control, right? Mm-hmm. Yeah. So if I come in to see you, could I come in just for like a physical? Could I come in just say, hey, I just want really great health care?
Yeah, you could. Although I'd be kind of like scratching my head. What do I do? What do I do?
That's kind of so easy for you, right? But also like if I just needed like a driver's license physical or something, I could see you. But that's not really. You're really looking at complicated problems.
More of a consult, and trying to figure out what's wrong.
So you would see the patient who can't figure out what's going on, and you're going to really dig into what might be going on and research it. And as you said, you feel you owe it to the patient. It's just something you do. It's how you're wired, is to figure it out.
Yeah.
And work through that.
Yeah.
So I also want to talk about the Spring Summit, which is April 25th and 26th. And you're going to be talking there. What are you going to be talking about? Or you might be
Hormones.
talking there.
You know how I love public speaking.
Yeah, I know So this is, I will say this. So Dr. Smith is maybe one of the smartest people I've ever met, and brilliant. And her clinical acumen and her application is second to none. I think she's amazing. Just like, I don't think you'll find a better physician on the planet. With that being said, one of your fortes is not public speaking.
Absolutely. But anyway, my talk is going to be about hormones and trying to optimize them through a functional medicine approach. But I also hope to talk a little about some of the the bioidentical hormone treatments and what they can offer for people that can't get above a good physiological level where they want to be, and they're sort of stuck at a lower level of hormones. So kind of both supporting the body in its own physiology, but then when the physiology isn't enough to overcome Alzheimer's or dementia or other physical ailments like migraines, something else that they can do with bioidenticals that might be helpful.
So help me understand that a little bit more. So if you're saying if let's take your lecture and apply it to a patient, somebody who's struggling with like hormone issues, looking at it without just giving hormones. That's what you're saying. Right. But also giving hormones.
Right. If they're need. Yeah. Okay. One of the things that's hard to figure out is if they need the hormones to get their lifestyle back in order. So if they're feeling lousy, they're not sleeping well because their hormones are all off. They're waking up in hot flashes. It's very hard if they're not sleeping to get back to health. So sometimes you need to add it in earlier on, depending on how symptomatic they are. But for the most part, you're trying to address the pathways of the hormones. Where's the dysfunction happening? What's triggering into that? Is it stress or is it diet? Blood sugar's going all over the place, which is triggering their symptoms. For men, is it estrogenic-like compounds in their body that's causing them not to produce testosterone? Just trying to look into all the issues of detoxifying what we're getting into our bodies, putting in the right things, getting the stress under control, adding in other nutrients that might make the pathways work better in terms of the hormone balance. So it's kind of getting at a deeper level of the functional medicine end of hormones.
Yeah, I love that. I know I've sent you countless patients for hormones, and you've resolved them quite nicely. So in a way that is not detrimental to their long-term physiology. So like equine estrogens and different things, you're using some really bioidentical and also using some nutritional supplementation sometimes to help them in changing their diet even.
Right.
To be helpful.
Yeah, and bioidentical basically means that it's the same hormone that your body naturally makes, not a synthetic compound that's different, that doesn't mimic normal physiology. So we're trying to mimic normal physiology.
So it's actually bioidentical. So it's your body wouldn't know the difference between that and what your body made.
Right.
Synthetic may have a similar effect, but be a little bit different.
Right, and there might be other adverse effects from it.
Right.
Especially in the progesterone, natural versus synthetic. There's huge differences with cardiovascular health and breast health. So definitely makes a difference if you're using bioidentical in that case versus synthetic. But there are some good prescription estrogens out there that are bioidentical, and prescriptions that are for progesterone that are bioidentical. So I usually choose that route.
So is that something that's going to be one of these very expensive special pharmacy things, or is it not that expensive special pharmacy thing, or is this something that can be through your regular pharmacy thing?
So you can get some of it through regular pharmacies for sure. If you need a different dosage or a different type of application, like a lot of them come in patches or gels, but you can use a compounding pharmacy to get the precise dose that you need.
That's not always terribly expensive, though, is it?
No.
No, it's reasonable. Mm-hmm. I think a lot of people.
And some insurances may cover compounding.
Perfect.
As well. Not all of them, but so depending on the patient's needs, if they don't have a lot of income or they need a pharmaceutical, we'll work with that. If they want something more customized, we have those options.
And I think most importantly, you bring the knowledge base to say we have the option to customize this in 1,000 ways from Sunday. We can make a little bit more here, a little bit more there. It's not a one-size-fits-all hormone. Even if you're using hormone replacement, it's not, well, you're a female, this is what you get. You customize it to their needs.
Mm-hmm. Yeah. And it's about balance between all the hormones.
But you do not just assume they're feeling bad because they have hot flashes, because a hot flash could be many things.
Right.
It could be Lyme, as we talked about earlier.
Right.
So you do some pretty detailed and advanced testing for hormones, don't you?
Right.
Yeah. So tell me a little bit more about that, because I know some patients will come in and said, just like with Lyme we talked about, I've been tested for it. Well, my hormones, I've been tested for it. So what other types of testing might you do? Right.
So most people have had blood tests, but some people have never had their blood tested for hormones. Right. But you can also do saliva testing. Those may not be covered by insurance because that's, other than cortisol. Cortisol's the standard one that they use in the traditional field, but tissue levels, you need saliva sometimes, but the hormones for sex hormones may not be covered.
Okay.
And then urine hormones tell you about the metabolism of the hormones and where everything's going.
So what does that mean, the metabolism of the hormone?
So you could have high estrogen levels in the blood, and they're going down a certain pathway as they detoxify. So normally every body chemical is detoxified some way, and hormones is one of those. So they go down 3 different pathways standard way. One is more protective, one is neutral, and the other can be more carcinogenic. So we like to make sure that your hormones are going down the proper pathway of detoxification and not promoting cancer, or making sure that the testosterone estrogen balance is correct.
Okay.
The progesterone balance is
So you're
correct.
saying like the estrogen can go, once you kind of break it down, it can go down one of 3 roads.
Right.
And each road has a different outcome.
Right.
So it's really important not just to measure your estrogen level, but also how it's being broken down.
Right.
And
And different foods and nutrients can affect which way it goes.
Coming back to the food thing again, if your diet isn't right, then it's not just your blood test for estrogen, but it's how your estrogen is broken down based on the foods you ate.
Right.
And I know this detoxification is a subject that some people get controversial. So we could call it biotransformation or conjugation as well, right? So those are in the literature. Oh, there's no such thing as detoxification. So another term would be biotransformation or just conjugation, which we do every day. Mm-hmm. So it's important then, it seems to me, it would be very important to check out not just how much estrogen I had in my body, but which highway it went down.
Right.
If I went down the wrong highway, you're saying it could lead to cancer?
It could.
Yeah.
Yeah.
I
some
think
of those
that's important.
some of those metabolites can be carcinogenic, especially if someone isn't methylating. Not to bring up that huge topic, but if they're not methylating well, then they have an intermediate that's not going to be helpful for them. So that test in the urine also measures how well they're methylating those hormones to take them to the next step where you can excrete it.
Seems to me then, if I did my blood work, I might need a little bit more information, much like we talked about the Lyme disease. I might need some more information. And that information isn't always covered by insurance. But again, that's not thousands of dollars, is it?
No, the urine test could be anywhere from $150 to $250.
Okay.
But you can do some of those in standard labs. But for those more advanced testing of biotransformation, you need another lab to do that.
Okay.
But you're not doing that test all the time.
Right. It's
You
not a
might do it-
repeat every week.
Right. It's not a super frequent test, but just to make sure you're on track.
But I think I would want to know if I had stuff floating around my body that was carcinogenic, that I
Right.
wanted to help get rid of it, which I could eat different foods and change that.
Right.
That's-
And, most people, if they eat broccoli, cauliflower, cruciferous veggies, flaxseed, those are things that often will help most people. So if they're eating a lot of those foods, at least they know they're a little bit protected.
So again,
Even if
that
they don't-
diet makes a big difference on how I send that estrogen in this particular this particular example down the highway.
Right. Right. And then same with testosterone. In a man, what's happening with his testosterone? Is it turning into estrogen?
Right.
Or is it
Well,
going
that's
down
a key point.
that
So
pathway?
you're saying testosterone can turn into estrogen in a man.
Right. And if he's heavy, especially, and there's more adipose fat tissue, the testosterone is going to turn into estrogen more. And then not only does he possibly get man boobs, which no guy wants,
Right.
but then that estrogen also has other effects on the prostate. DHT might be formed from the testosterone. So there's other pathways that testosterone can go down.
So
which
it's a
can
deeper
affect-
conversation that I'm going to go out on a limb and say that your average standard allopathic primary care 15-minute visit doesn't always address.
Right. And I was in that world.
And I'm not picking on them because
Right.
they have an unbelievable responsibility to
Oh, yeah.
manage the the war zone of healthcare. I get it.
Right.
But if you're looking for, and if it's easy, you don't need to come here because you're going to say, well, this is easy. You can go to anybody and have this done. You want to be the person who's like House, who says, I want to figure it out, and
Right.
it's not easy. But it may take a little bit more investigative work. And you
Right.
typically don't do 10-minute visits, do you?
No, most of my visits are 30 minutes to 45 minutes.
Yeah.
And new patients are going to be longer than that. So you really need the time to delve into these things. It's not just a quick, here's a script,
Right.
and this will fix it. And most people coming here don't want a script to fix it.
They've been down that road.
Yeah.
Right. Most people have
They're-
already tried the script to fix it and didn't
Yeah,
work.
yeah. So we're trying to get people off medicines if possible, or
Right.
try to get them in a more healthful state that they don't need medicines. So we're trying to get into the underlying, what can they do lifestyle-wise, or, even social stressors, that might influence pathways. Because stress is huge in the hormone pathways.
Right. I know
Instead
that's
of
something
making
else
sex hormones, you're making cortisol, which is your stress hormone.
So that's interesting too. The stress changes your hormone levels too, and I think it's important to point out that if you have low hormones and you're under stress, sometimes the answer is not give the hormone, but fix the stress
Right.
if you can.
Right.
And
And some
I know
people
that-
don't even know they have stress.
Right. And so there's tests for that, aren't there?
Yes. Yes. So
So-
everybody thinks that, I'm fine, I'm dealing with it well, but maybe they're really not.
All right. So
Until it
a
explodes.
complete workup with testing that is not your standard inside the box testing. Most of the time covered, but not always. And I know even speaking of stress and mood, there's a couple aspects I want to point out. You understand this field very well, but I think a lot of it goes to your presentation as a physician. people feel comfortable sharing with you because you care about them and you have compassion for them. So I think it's more than just a test. It's the provider. Mm-hmm. And I know I've had countless patients say, she listened to me, she took the time, I felt comfortable sharing where I didn't feel comfortable sharing before. She didn't judge me, she didn't tell me, well, that's wrong, and you need to, get more sleep or eat this way, but help them softly understand it. And that's such a huge component of this stress and world we live in, is having an advocate who's your partner.
Right. And I think it's great we have a psychologist now here that can help with that part.
Yeah, we do have a psychologist, Dr. Panettone, which I think is amazing, and it's a great adjunct to what we do. But I don't want it to fall on deaf ears. You do a lot of that already.
Right.
Not that we can't always use Dr. Panettone, because I know we refer to her quite a bit, but it's nice when your first step into this is met with a soft landing in your office to say, it's okay. Mm-hmm. We're going to work through it, right? Mm-hmm. So it's just one of those things. And you're not opposed to the medication when it needs to be there, but your goal is ultimately to change their lifestyle.
Yeah.
So that's wonderful. So I could come see you for a plethora of reasons. I know we kind of dove in a little bit of Lyme disease, a little bit of hormones, but you can take on any kind of traditional, like, I need a family doctor who thinks outside the box, who's still going to do my, check my mammogram, or maybe you want to get thermography instead of mammogram, but you're going to not miss the things that need covered. Right.
Well, I'll support them with what they want to do. If, like you said, if they're really against mammograms, well, you can do a thermogram, or you can do just breast exams with close monitoring. So I customize it to their needs, whether it be vaccines or colonoscopies or not, or a lot of people just want to have a decision in their own health care, and they need a coach to help them along what's best for them.
It's a great point. I know it's controversial, but if we leave the controversy aside over, mammograms versus thermography, or vaccines or not vaccines, or the flu vaccine or not the flu vaccine, the patient's decision doesn't dictate whether or not you're going to care for them.
Right.
And we're seeing that a lot in healthcare today. Well, if you don't follow my rules, you can't be my patient. And so talk a little bit about, if I come to you and I'm a nonconformist, what is that going to do? How do you deal with that? Like, I'm not going to do what everybody says I should do.
Right. Well, I try to find out, well, what do you want from me? How can I help you? What do you need in terms to get healthy? And if they don't want to do a certain test, I'm not their God, as you often tell me. You're not their dad. I'm just here to support them in however they need supported, and
with excellent care. It's still excellent health care. It's just, I see so many people that get dismissed as patients because they refuse to follow what the doctor said. Right. And now they're left with no health care.
Right.
And so, going back to your compassion and your knowledge, the compassionate part says, I'm not going to kick you to the curb because you didn't do what I said, but you're still going to tell them what they need to hear, not just what they want to hear. Like, I need to share this information with you because it's important. And if you choose not to do it, you're not going to dismiss them as a patient.
Right.
So.
And I figure I'll jump into the medical marijuana end too.
Sure, let's jump into that. Medical marijuana. Yeah. You are early on where, I don't know if it's a certification. Help me understand what qualifications you have to be even able to. It's not really a prescription, is it? It's a certification. Talk about that. Help me wander through that navigation.
Basically, I believe you still have to be a physician. I don't think other types of providers can yet, but there's no reason they shouldn't. But basically, I just had to do a course on medical marijuana, some of the types of it, how the process whole works. And it was a very short course, but I just certify patients that might benefit from medical marijuana. And I've found it's been amazing how much benefit there's been with certain patients, especially who tell me, I've never slept that well. They gave me something and I've slept for the first time, the whole night. I feel wonderful. My pain that nothing would help is gone.
And these are people who have tried a lot of drugs.
Yes.
A lot of medications, right?
Yep. Even autistic kids that had behavioral issues, irritability, anger, violent. mom comes back and like, oh my gosh, this has helped so much. It's really been amazing to see how that's been. Yeah, I know it's not for everybody. Not everybody comes back and says that was amazing. And obviously there can be some side effects while you're trying to get the right dose. But I think that's been huge. And the course is basically just, you're a patient that would probably benefit from this. And so they come to see me and tell me their story. And now even post-traumatic stress patients are, getting off some of their medication, which is great.
That's great. Yeah.
Even some bipolar patients have been able to reduce some of their medication. Not saying that this is the treatment for it, but it can help in so many ways that I would never have dreamed.
That's amazing. And so, and to see those changes firsthand in front of you. And again, implementing this lifestyle medicine as well. So it's not just you come in, you get a rubber stamp, you get your marijuana, and you're on your way. You're also counseling them on different ways to change outcomes in their health.
Right. And a lot of times they tell me, can I be your primary care patient? Because my doctor doesn't
believe in this.
Doesn't, They won't see me if I'm on this. And
That's
it's kind of sad to hear that.
Back to the same thing. I'm doing something that helps me. Well, if you're not doing it my way, you're dismissed as a patient.
Exactly.
That's not what healthcare is about.
Right. And I think eventually that'll turn around. But for right now,
at the detriment to the patient.
For right now, it's a need that they are getting that they couldn't get elsewhere. So I'm happy to provide them and that to help them.
So some of these patients are coming to you out of desperation to maybe see if they qualify for a medical marijuana card, and then they realize they can share with you all the aspects of their health, including trying marijuana, and you can become their primary care physician that incorporates those alternative lifestyle choices.
Yeah.
That's impressive. I think that's such a missing piece in healthcare now. Again, I will force you to be a square peg in a square hole, as opposed to the latitude to be whoever it is you want to be.
Yeah.
So
I'm very glad I got certified.
Well, so are we. We're very glad you got certified. It allows us that don't certify to see the tremendous opportunity for health improvement when some patients get on the medical marijuana. And I know it's sometimes difficult to play with, like you said, play with the dosages or the strains, or it doesn't work for everybody. But boy, for the people that it works for, it's so much better than some of the strong addictive
pharmaceuticals.
Yeah. So talk to me about some of the alternatives that were traditionally used for medical marijuana that are detrimental.
Yeah, like OxyContin.
Yeah.
People have been able to get down on their pain meds, which are very addicting and very dangerous.
And many times they increase over time, the pain meds, right?
Right. Yeah. And they actually have a hyperalgesia, they call it, effect that the more you're on them, the more you're going to have pain. And so
you take it for pain, but then it becomes a pain-generating phenomenon.
So then they need more, and then they need more, and this is a way of getting people off of it. And I think it's partially responsible for the drop in the opioid deaths. Okay. A lot of people are not as needing those high, strong drugs now. And
they don't get hooked on them.
Right.
So do you see any benefit, and we'll jump into CBD as opposed to, what's the difference between CBD and medical marijuana? Yeah,
and usually I'll ask them if they've tried CBD first.
Okay.
But CBD has no THC, which is the psychoactive component that you get in marijuana. But it has a lot of properties that whole marijuana plant would give you. But THC has another additive effect that some people can't get from straight CBD.
Okay.
It has other properties that might be beneficial when the CBD doesn't quite do the trick.
But do you see CBD ever working in somebody alone?
Yes.
Okay. Mm-hmm. So sometimes it's CBD and sometimes then it's CBD and the medical marijuana or just the medical marijuana?
Right.
But they are different. So I hear a lot, that's CBD. I can't take that marijuana. It's not marijuana.
Right. It comes from the hemp plant.
Okay.
So there's no psychoactive component in the CBD.
Hemp plant, which is funny because I went to the high school called Hemp Field. So clearly at one point there was fields of hemp everywhere, and now it's some kind of,
Yeah.
And I know the 2016 Farm Bill allowed us to actually use hemp again in hemp products, and so we're allowed to grow hemp again. So
yeah. So usually I'll say, if you've tried CBD, how does that work for you? If that didn't work for you, why? Did you ever try marijuana before? Or if anybody gave you some of theirs, And people feel relieved is that, oh yeah, I can say that. I'm not.
Again, they're able to talk to you. They're just able to talk to you because you open the door. Hey, have you ever tried that? And they're always afraid, well, are you going to put me in jail? And you're like, no,
right.
I'm just concerned about your health. So I interrupted you. I'm sorry.
No. So I find it's nice to be able to have that dialogue with them and they feel comfortable talking about that. Or if they, had issues with other, drugs, well, there is some addictive potential for marijuana, but if this is going to help you better than what you're on now, I'll be for it.
I know I went over to the dispensary and I talked to them when they first opened, and they had said that 80% of their patients who were sent there with a medical marijuana card for legitimate medical reasons had already tried it on the street because they were so desperate for intervention that 80% of your quote-unquote typical American was willing to go to the street and try an illegal drug because of suffering that was not alleviated for anything else. So 80% of the people who were getting the medical marijuana card had already tried marijuana on the street. Mm-hmm. And I thought that was fascinating. And now we can do it in a safer. No drug is safe, or it wouldn't be...
Not completely safe.
Right, nothing's completely safe. But it's much safer and in a safer environment.
Right, and they know what you're getting.
Right.
It's analyzed and you know what you're getting.
As opposed to
on the street, you don't know what you're getting.
I find kind of funny some of the names they give to the medical marijuana drugs, like, I don't know, like Northern Lights, and they're the street names because that's how they got their strains, but that's the best way to get through it. So, yeah, I love that. You're always willing to never be closed-minded. So, okay, medical marijuana wasn't legal years ago, and now it is. You're on the cutting edge saying, I want to be certified and understand it, and then willing to talk to your patients about it, and then willing to analyze yourself and your patient's outcome to say, wow, this is working, and maybe they need less opioids.
Right. And some of the patients coming to me are cancer patients who, they've learned that marijuana can kill cancer cells. Yeah. And it can help their immune system.
And alleviate their pain.
Yes.
And help their appetite. And
Right. So a lot of people come for that purpose. Is they have cancer. They don't want to get cancer. They've had, something, breast cancer years ago, and they don't want it to come back.
Right. So marijuana has anti-cancer properties?
Yes.
Okay. Can you expand on that a little bit, or is it complicated? I don't know. I don't want to get you off the beaten track.
Well, it works on your immune cells, and it works on the tumor directly to some degree.
That's
certain
interesting.
types.
Certain types. That's interesting. It had this bad stigma forever. I think it was 1972, the World Health Organization said it had no medicinal quality whatsoever.
Right.
So we kind of stopped all the research on it.
Right.
And now we're realizing, whoops.
Yep.
I think to date for the CBD, there's at least 212 cannabinoid receptors in your brain, and I'm sure there's a whole lot more we don't know about, and THC receptors. And
right. I leave that to the pharmacists at the dispensary to figure out.
Yeah, let them figure it out.
The exact one.
Safe to say, there's an effect that has potential health benefits. And nothing is as powerful as a patient's outcome. So when a patient's doing better and off of their addictive medications, that's a good day.
Yeah, I know one particular patient came to me and she had had surgery for breast cancer. Horrible pain afterwards. And it was neuropathic pain, which is the nerve was damaged. And she tried everything. Hydrocodone wasn't working. And her sister said, here, have some marijuana. And she said that was the first time I'd had no pain. And It's just powerful.
That's powerful.
Especially if you have breast cancer, because you're in pain, you're stressed. Your immune system tanks. So if you can get their pain under control, if you can get their anxiety under control, it has so many other effects other than just directly from the plant.
Right. Interesting, you talk about breast cancer and immune system, and we talked about Lyme disease earlier, and I know you've spoken with Neil Spector, who's a world-class oncologist down at Duke, and I was quoting this earlier. He said that 80% of his breast cancer patients, they're finding Bartonella in the breast tissue itself. So that correlation between, instead of getting out of your silo of I'm just a breast cancer doctor or I'm just a Lyme doctor, we need a Dr. Smith doctor to say, let's look at the whole thing. Before you get breast cancer, maybe we have an infectious component. Do you ever see infections with cancers?
Yeah. I mean, Bartonella is a big one for breasts, I know, but Epstein-Barr is another one.
Yeah.
But
so Bartonella for breast, and Bartonella is not typically looked at very well, is it?
Right. It's hard to detect that in testing.
Yeah.
There's many strains of Bartonella, and you may not detect that as well as other regular strep throats and things like that.
Coming back to special testing sometimes, which needs to be done. So if we detect it through some special testing and spend a few dollars today, there's a possibility it could prevent breast cancer tomorrow.
Right. Same thing with iodine. The breasts and the thyroid are the two biggest things that need iodine, and iodine definitely can help with breasts too.
Right.
Preventing breast cancer. So if you're iodine deficient, you're more likely to have problems
with your breasts and fibroids and fibrocystic breasts as well. So, so that's something you test for, which again is not a common test.
Right.
Right. A lot of people are not running iodine, and
I would say most people I test are deficient.
I was going to say I don't want to speak about my patients because I'm talking about. I mean, how many times what percentage of time do you test iodine where it's normal?
Right. Maybe 10, 20%.
10, 20%. So that means of the patients that we see or you see, 80 to 90% are deficient in iodine, which has effect over. I mean, we understand thyroid and breast tissue, but it could have effects on other tissues we don't even know about.
Yeah. Hormones is another one.
How's that? Try that into me.
Oh, iodine affects the hormones as well.
And walk me down that path a little bit.
No, I don't think I know the path.
Okay. we actually took a long time, but we found something you didn't master so far. But I'm sure by the next time we talk, you'll have that whole pathway mapped out. So, so again, kind of putting out there, soup to nuts, internal medicine, A to Z, deep dives. I know you've helped people with heart conditions and cancer and Lyme disease and mood disorder and anxiety and changing their lifestyle. Is there anything we haven't touched on that you'd like to bring out on your first podcast?
Oh, well, I think autoimmunity is big.
Okay.
And one thing I really like is LDN, low-dose naltrexone.
Oh, great. Yeah, tell me about that. So LDN, I know, is something that's been around for a long, long period of time, but doesn't get much press. Tell me about, first of all, what is naltrexone?
Right. So naltrexone is what they give people when they overdose on opiates or narcotics, heroin.
Okay. So
they give them the naltrexone, and it blocks the opiate receptor, takes them out of their overdose. But we can use it in very tiny amounts, a tenth of the normal dose, and it blocks the opiate receptor, which is the endorphin receptor, briefly. And when that happens, you take it in the evening, and it comes out where your body goes, I'm not making any opiates. I need to make more of these endorphins. So you make more endorphins, and over time, that has a long 18-hour effect of higher endorphins. So
which makes me feel good. Like endorphins, don't they make me feel good? Like the runner's high and things? Yeah. Okay.
Right. So they might have less pain. The endorphins actually bind your immune cells and activate them in ways that help your body kill off pathogens, tumors. It can rebalance the immune system. Reduces inflammatory cytokines, which are the chemicals made that cause pain and inflammation. Travels into the blood-brain barrier, into the brain, and can reduce neural inflammation of the brain. Helps tone down the microglia in the brain, which is one of the ways that it can help fibromyalgia.
Wonderful. So low-dose naltrexone, LDN, what are the downsides to it?
Not much.
Yeah.
I have not really, other than temporary insomnia some people may have. Usually that goes away. Occasionally some people may be a little anxious, and it could be a serotonin or dopamine effect.
But you don't see that very often.
Very rarely, just a handful. But most people, it's not a wow, I just took that pill and I feel great. It's subtle. It takes longer to kick in, but it does have research behind it. There's quite a bit of research on using low-dose naltrexone for various things, and a lot more research to come.
Yeah,
but I found it helpful, especially even I've had environmentally sensitive people.
That helps with that.
Helps with
if
that.
it modulates your immune system or something. I mean, I first heard about LDN in 1995. It's been around for a long period of time. I don't know why it hasn't caught any traction. I know you use it a lot. Well, so who wouldn't take that?
I don't see anybody that wouldn't benefit.
Right?
To be
Who
honest.
wouldn't? You talk about like I'm gonna make more of these feel-good endorphins and enkephalins, and that's going to change my immune system and bind to it to say be happy, not angry,
right?
So to speak. And
most of us, as we get older, we naturally our immune system goes down.
Right.
So,
you get that thymus gland that deteriorates and shrinks in size, and
right. So if we can improve everybody's immune system, they're going to live longer. They're going to have healthier lives
and happier.
Yeah.
Make them
and it heals the gut as well.
I need to get on some of that LDN stuff.
Yeah. Yeah.
I don't know who. Yeah, it sounds like who wouldn't benefit from that, right?
Mm-hmm. Yeah, and using it for cancer, like it's another thing in the toolbox to use.
Another piece of the immune system that can change and lead to better health expressions.
Mm-hmm.
Great, that's a brilliant.
So I'm all for research to support long-term outcomes to see where things are going, but there's a lot of research for certain conditions, and other ones just patients have reported. So.
But the risk is very low. I mean, like you said, to try it, very low risk.
Right.
Is that a very expensive medication? Is it typically covered?
It's compounded, so depending on their compounding benefits, but usually about $60 for a 90-day supply.
Oh, that's pretty reasonable. Yeah.
And their insurance may pay for it, they may not.
Okay.
Definitely it helps to check around different pharmacies because different prices at different places, and I can always tell you where the good ones are.
I know, again, with your care and compassion for the patients, you're typically looking to be stewards with their pocketbooks and wallets too. So if you find 3 pharmacies and do the same thing and one's cheaper, you're always going to look towards that pharmacy. I know you care about not just the health expression, but what's in the best interest for the patient.
Right. And even their insurance companies. I look at the drug on GoodRx and I say, how much does this medicine cost? If it's a $5,000 medication, maybe there's something you could do differently.
Right.
But I use GoodRx every day, like several times a day, if people don't have health benefits where they get their prescriptions covered. And I find, hey, you can get it here at Giant for less than your copay might have been on your insurance sometimes. It's amazing.
Yeah, and just another way you're looking out for the patient. Full soup to nuts from your health care to, it's pretty stressful if you can't even afford your health care. So there's ways that we can reduce the burden of your prescription drugs, and you take that into account.
Right.
Fabulous. So what other topics? I'm sure we'll have more of these in the future, and we'll probably do some deeper dives on a specific topic. I know a lot of people have asked us to go into specific topics over, hey, can you discuss this more or that more? We might have a whole show just on maybe hormones, or maybe we talk about autoimmunity and the immune system on one, or maybe we talk about just medical marijuana. But I just want to open the platform up to anything else you wanted to talk about.
I think that's quite a bit of stuff.
I think it was quite a bit of stuff, yeah. So hopefully it gave a good idea of what to go out there. And I really look forward to hearing your lecture, and also look forward to doing another one of these podcasts with you on a specific topic.
Great.
Thanks so much for coming in today.
Yeah, thank you.